Hello everyone, this is a very nice question to explain concern versus fact. So now, one of the very few occasions when you have a fact, you don't need to gather more information. You've already started doing the right thing by discussing with the nurse, and it is a fact. She is fabricating the observation, which is immediate patient safety. She could fabricate something, and you rely on that and change the plan of management, and it is not the case. So it is immediate patient safety. Potentially, let's say. However, it is a fact, so you need to take an action. If it was just a strong concern, you need to gather more information to discuss with her. So this is something against patient safety, and it is a fact, and she definitely knows that is incorrect, because we had an example and a role. You cannot explain unexplainable thing. If your colleague, senior for example, even if junior, stealing something, being racist, you cannot explain, oh, this is racism, we don't accept that. So there are very few things that we don't explain. They are known by nature. So you need to take action. So you have, it's a fact, something unexplainable, that fabricating observations. So you need to take action. That's fine. So I need to escalate. That's the action. I cannot, for example, talk bad about how something, I need to be professional. So how can I take action? Either escalating to my consultant, my senior, or her senior. And we had a role before. If someone is doing something, you need to escalate to your senior. He will communicate with her senior or his senior. However, when it's about patient safety, there is no enough time for that. You don't have that luxury. You just escalate immediately to her or his senior. So here in this case, it is a fact. You need to escalate. And something you've done to explain before. You don't need to re-explain that. And it's not explainable in the first place. Number 3, it's about the patient safety immediately. So you need to do the shortcut, to go through the shortcuts. That's why it is a fact. That means facts equal action. We had that before. And patient safety immediately means her senior, not your senior. So that's why nurse in charge, then your consultant, which is a form of escalation as well, then to reiterate with her. Classically, when we are repeating, the correct step would be number 2. However, this is not the correct step. It is a fact and about patient safety. You don't need to reiterate to her. You need to escalate, to take action, not to gather more information and to discuss your concern with her. There is no more room and window for discussing concern. It is a fact now. You need to take action. That's why it is not a correct answer in the first place. I will keep it as number 4 or 5. However, the other 2 are even worse than discussing with her again. That's why it came number 3 here.